Hi, this is QD Clinic brought to you by RheumNow.live. I'm Jack Cush with RheumNow. Our case today is about breast cancer. A 39-year-old flight attendant has been seen by me for years, has rheumatoid arthritis, is taking a TNF inhibitor and doing very well. In fact, she's been in remission for 3 years now. She's strongly seropositive. She started out with treatment with methotrexate and prednisone, which wasn't sufficient. It was switched to a TNF inhibitor and has been in remission ever since. Methotrexate and prednisone was withdrawn. She's been in relatively good health and has always been concerned about the cancer story. And her story is that her aunt had breast cancer and died from it. She's had annual mammograms for about 3 or 4 years now. And now she has a lump and is about to undergo a breast biopsy. And there's a lot of panic in the room and in other clinics about her rheumatoid arthritis and this drug that she's taking, the TNF inhibitor. And the question is, how does that get managed? The right answer is, it doesn't get managed, it is continued. There's no reason to stop a TNF inhibitor in this situation. The ACR guidelines on RA management, I have some problems with, but the one thing I like about that is that they said if a patient has a risk of or an actual solid cancer, solid tumor, that would include breast, you treat rheumatoid arthritis as if you would normally treat it, meaning treatment will not affect the outcomes here. But yet, whenever there's a whiff of cancer in the air, there's a lot of knee-jerk decisions that go on which don't make a lot of sense. Again, if she has cancer, her outcomes will be worse if her arthritis is worse, if inflammation is worse. If she doesn't have breast cancer, you will stop the drug and created even more fear. Again, your confidence in the drug has a lot to do with what other people's confidence is going to be. Again, these drugs have been on the market now for almost 20 years. Back then, maybe there was a reason to worry about the long-term consequences of TNF inhibition and that maybe it might change immunosurveillance in some way, that cancer would become more prevalent. But the data is very clear. These do not cause solid tumors. And in the case of lymphoma, the lymphoma rates are on par with what the rheumatoid arthritis rate is and is not augmented by the TNF inhibitor or by other biologics. So your job is to treat the arthritis and let someone else treat the cancer. And don't ask the cancer doctor for advice on what to do. He knows the data less than you do. You should assert that ongoing therapy for rheumatoid arthritis is practical and indicated until a contraindication comes along. Being on a TNF inhibitor is not a contraindication for a cancer workup or for actual cancer. That's how you should manage it. And there's hundreds and hundreds of thousands of patients and research that support that contention. And again, you should look at the literature on this if you're still in the doubt. Again, many people practice here what they don't know, meaning they're a little concerned, they don't quite know the data, it seems right to stop the therapy. It's all wrong. You treat the arthritis, let someone else treat the cancer. Check out RheumNow.live. Check out the faculty. It's going to be unbelievable. March 22 through 24. It's coming up in 6 weeks. We'll see you there.